Good afternoon and welcome back to GP Video Podcast by Nadia. I know that till yesterday we were talking about weight loss injections, Mounjaro and Wegovy. We will continue with them, but for now, because it was getting a bit boring as I was delving deep in the mechanisms of action to tell you what are the differences and what you should choose when, we will come back to it, but now I would like to again touch a very important topic that I've gotten some feedback from the people who listen to my podcasts, and they said that they found Dementia podcast very interesting and very informative. So I just wanted to go back to Dementia podcasts, and I would like to do this going back, and because all the topics that I cover, they are very lengthy and I can only make a 5 to 7 minutes video, because if I make more than that, it can't be uploaded on Facebook and YouTube and all. I don't know the techniques yet. So I try and keep them simple and little so that, you can just listen to them and then go back to your work. So we'll be coming back to the different topics that I've been covering, and we'll be going to new topics as well. So we come back to dementia. In my earlier podcasts, I think I've done 3 to 4 podcasts on dementia, and I've explained what is actually dementia and what are the 14 preventative strategies that have been identified for dementia. One of them is very important that we haven't spoken about in detail. Few of them I spoke about cognitive stimulation, how good quality education and cognitively stimulative activities are very important at work. Then we spoke about hearing issues, vision issues, and I named all of them, like exercise, obesity, depression, high cholesterol, diabetes mellitus type 2, smoking, alcohol, head injury, high BP, air pollution, all of these are related to developing dementia, and what should we be doing in preventing dementia, in correcting all of these factors that I have said. But one of them was very important, which is depression, as how can depression lead to dementia, and how can we use depression and its treatment as preventative strategy. So I'll talk a bit about it in this, and I might have to continue it in the second podcast as well after this one. So depression and dementia. Research shows that there is a clear significant link between depression and dementia. A recent analysis, which was published in Lancet paper, looked at 7 studies that followed people up for 14 years. That showed that people with depression, so there was a recent analysis that looked at 7 different, there have been studies before that as well, but this is one of the most recent studies. In this analysis, this meta-analysis actually looked at 7 studies. These 7 studies followed up people for 14 years that showed that people with depression have double the chance of developing dementia than people who don't. This is a big deal. So people who have depression in earlier ages, like in their 20s, 30s, 40s, 50s, 60s, 70s, they have more than double the chance, they have double the chance, like 2 times the chance of developing dementia than people who do not suffer from depression. This is a big deal. What's interesting is, though, this risk is present at all ages. So whenever you have depression, like maybe in your, God forbid, in your teens, 20s, 30s, 40s, 50s, 60s, 70s, whenever you have it, you will still have increased risk of developing dementia later. But it's especially relevant to midlife depression. So midlife depression is a strong indicator of developing dementia with aging. Now, what is the theory? How can depression lead to increased chances of dementia? So there is no clear mechanism, but there are 2 theories that have been proposed. One of them is less self-care and social isolation. So people who are depressed, they don't take care of themselves and they are socially isolated, both of the factors are important in prevention of dementia. So if you take care of yourself, your brain, it is important in preventing dementia, and also social interaction is also very important in preventing dementia. But because we do not take care of ourselves when we are depressed, and we tend to get socially isolated. So these 2 factors can lead to like increased chances of developing dementia later. The other theory is that depression causes increased production of cortisol, which is a stress hormone, and that can damage hippocampus, which is one of the parts of brain which is related to memory. As you know, in my definition of dementia, that dementia actually is dementia is something that reflects in the process of thinking, memory, and behavior issues. So hippocampus is related to memory, and cortisol can damage that part. So that's why you get memory impairment of dementia, and that is a strong indicator of getting demented at a later age. So then these studies also looked at the people who got their depression treated and at the people who got their depression did not treat, who did not treat their depression. And this treatment could be in the form of medications and therapy or both. And mostly it is both of them, which is very, very beneficial. So people who treated their depression either through antidepressants or therapy or a combination of both, had significantly lower risk of developing dementia. In fact, their risk was reduced by 30% compared to those who didn't get treatment. So if you are dealing with depression, or if you have people, because they say that in Australia, 1 in 4 people have diagnosed depression, while I think the rest of the 3 may do have the symptoms, but they are not officially diagnosed. So, every other person is, at this stage is fighting with anxiety or depression. So it is very, 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 very common. So if you are dealing with it, or if you have people around you who are dealing with it, please go for treatment, either in the forms of medication or therapy, or better would be that go for both, please. Because it is not about improving mental health at this stage, but also about reducing the chances of getting demented in later life. Tomorrow we will talk more about it, because now I want to talk about the myth that the people had before, that antidepressants can cause dementia. I want to burst the bubble of that myth, and I also want to talk about depression and dementia together. So in people who are demented, how do we approach treating depression in demented people? Talk to you tomorrow.